Hi, my name is Alex DeGaulle. I'm the owner of 360 Wellness, and I'm also a family nurse practitioner. And a big part of my practice is obesity medicine. So we're going to talk through the glucagon-like peptides and the GLP-GIP combination medications, how they work, what they do, safety, efficacy. What is a GLP-1 medication? It is a glucagon-like peptide. It is a naturally occurring hormone in the gut. It helps to regulate blood sugar and appetite control. The two biggest things these medications do that set them apart from every other weight loss medication to ever come to market is they work on our brain and they work on our gut. So they work by stopping something called food noise so we can hyper focus on the lifestyle modifications we have to make, which are sometimes impossible for patients that experience food noise. Food noise is hard to explain, or it's really been hard to find a definition to food noise. But the easiest thing I can tell you is it's someone who constantly thinks, obsesses, and ruminates about their next meal. And what that means is they could be going to bed at night and they're already thinking about what they're going to have for dinner the next night. They help to turn off the food noise so we can hyper focus on all the things that matter in obesity medicine. We think about sleep, stress, movement, fuel, and any medications you're on that are helping or hindering these conditions in regards to weight management. So there are many different types of medications that we can use, and the most popular recently have been the GLP-1s and the GLP-GIP combinations. So for instance, semaglutide, which is Ozempic in regards to diabetes, and Wegovy for weight management, liraglutide, which is Victoza for diabetes, and Saxenda for weight loss. We have oral semaglutide, which is Rybelsus, and then we have the GLP-GIP combination that is Mounjaro for diabetes and Zepbound for weight management. These medications have many benefits. Some of them are good for cardiovascular disease. Both medications lower the A1C, which is our average glucose levels over a 3-month period, which is what rises to a level of 6.4 to be diagnosed with diabetes. In regards to weight management, these medications, depending on the medication and the modality, can help you to lose 10-15% of your body weight, and the GLP-GIP combination medications such as tirzepatide, Zepbound, and Mounjaro can actually help patients lose over 15% of their body weight. Beyond the benefits of weight loss and diabetes, these medications some of them are approved and also being studied to help with cardiovascular disease. They are renal protective, meaning they protect our kidneys from kidney disease. And there is a lot of research. Currently, there are a few studies that are talking about using these medications to help correct something called fatty liver disease. And there is a lot of research and up-and-coming clinical trials looking at inflammation. There are studies currently looking at using GLP-GIP combination and GLP-1 medications to help with PCOS and infertility. These medications do not come without side effects. But when you think about the clinical trials, these people were sitting on their couch doing nothing, taking these medications. So they weren't working with nutrition. They were not moving their body. So a lot of the side effects, because they slow something called peristalsis, which is the movement of food through our stomachs, if you eat something fatty, fried, sugary, very heavy, rich pasta or red sauce, you're gonna have some GI side effects. So it's really important to use these medications in conjunction with lifestyle modification, especially nutrition and exercise, to lower the risk of the GI side effects. And if you lower the risk of the GI side effects, these medications are pretty well tolerated. There are rare but serious complications such as pancreatitis, gallbladder disease, medullary thyroid cancer, which was found in the rat studies but could not be replicated in the human studies. There are a lot of myths and misconceptions that are associated with GLP medications and GLP-GIP combination drugs. The biggest thing is these drugs are not a silver bullet. So if you take these medications with no lifestyle modifications, you may lose weight. You may lose a lot of weight, but the problem is you can't maintain that weight loss without the crutch of these medications. So for some people, they do have to take these medications for the rest of their lives. Other people just want to lose a little bit of weight that maybe they have gained since they became a mother, or maybe they had a major life crisis such as a loss of job, loss of loved one, and they stopped taking care of themselves and they're ready to get back on track. But for some people, they really need this medication and the way it works on their brain to implement the lifestyle modifications, to be used as a tool along with lifestyle to have long-term success with weight management. One of the biggest issues that we have currently with these medications is the access to these medications and the availability in regards to insurance and compounds, and the fact that it's high in demand, but some of the pharmacies can't keep it on the shelf. A lot of insurance plans change from year to year in regards to what they will and won't cover in regards to weight management and obesity medicine. So there are a lot of options in regards to all of those things. And if you come to the office and you want to utilize your insurance, then that's something that we can work through. It just looks a little bit different. So we'll welcome any patient that wants help losing weight. And sometimes you need to go through certain steps with your insurance plan before they'll cover a medication, and we can help you to work through all of those things. The biggest thing to take away from this video is that losing weight is difficult. There's so many different things that we have to focus on: sleep, stress, movement, fuel, medications that you may be on or have been on for years that might actually be contributing to your weight that you don't even realize they are. So it takes a certain level of education and a understanding in obesity medicine to be able to take care of all of those things and manage all 5 of those things. So if you're not sleeping well, then that can cause weight gain. If you're not moving your body, that can cause weight gain. If you're not managing your stress well and you're just using food to eat and cope, those things can cause weight gain. So there's so many different pillars that we talk about in obesity medicine, and it's important to find a provider that can tackle all 5 pillars and kind of figure out a good balance of all of those things. And again, this medication is not a silver bullet. It is not the only thing that helps you maintain this weight for the rest of your life. It has to do with all things in your life and balancing everything.